All right, thank you guys so much for joining us this afternoon for this press conference. My name is Dr. Amy Thompson. I am the Chief Executive Officer at Covenant Children's Hospital in Lubbock, Texas. I'm also a medical doctor, so I still practice pediatric hospital medicine. Not full-time, obviously, but still do some of this. So thank you guys for joining us today. I just want to talk for a minute about what it is that we have seen with COVID-19, and probably specifically today talking about this in children and adolescents. We have had a COVID unit that we have had opened since March. In our children's hospital here, we take care of children. We also have women that we serve here at our children's hospital. So really what our COVID unit has served is we have had all children and adolescents that have been positive for COVID with symptoms that have been in the hospital within that unit. We also have had pregnant women who have delivered babies, and so that is what we have housed in our COVID unit since March. And things that you have heard on the news are all true. I mean, this is that when you look at things like the number of hospitalizations has been less in adolescents and children. We have had a high number of asymptomatic pregnant women who have tested positive, which is also consistent with what we see across the nation with these things. But we actually have had lower acuity than when you compare us with adult hospitals. And so when you look at the adult population that is admitted to the hospital, those things are all true. Probably one of my least favorite comments is when we take some of those things to mean that COVID does not have an effect on children. That is not a true statement, and that is part of the reason that we are here today, is to make sure that we have good communication about COVID in both children and adolescents. Really for us, what has changed is twofold. The first is we have had increased admissions to our COVID unit here at the hospital. That number for us really has been less than 10 at any one given time, since the beginning of this illness. But we have started to see increased numbers of children in the COVID unit. Still pretty consistent with what we're seeing with pregnant women. The second thing that has occurred is we are certainly seeing more severity of disease, and so kids that are requiring either longer hospitalized stays, potentially more support. So that is certainly something that we see. Probably for us, we have reached a milestone this week in our area with COVID that candidly was a milestone I hoped that we would not reach. And that is, you have probably heard, there is a syndrome that is called the Multisystem Inflammatory Syndrome in children, MISC. And I have asked a subject matter expert to come today to talk about this specifically. We have had some children come through our emergency department who have had some signs and symptoms that are consistent with MISC, but up until this week, those patients had not required hospitalization. And so really for us, the big thing that has changed this week is we are now on our second hospitalization for, we have had one child that was less than 10 years of age with signs and symptoms consistent with MISC. We have had one adolescent, less than 15, that we have also admitted to our PICU this week. Both of those patients were admitted to the PICU, and the milestone that I did not want to reach is we have had one of those patients pass away from complications of MISC with COVID. I have two goals from this press conference. The first is I want us to have an opportunity to make sure that we hear from an expert about what are the signs and symptoms to look for in specifically MISC. But I would say that the second goal that I have of this press conference is to continue to bring education to the public about the fact that this is a disease that, while certainly is affecting our older folks in a more profound way, we certainly see effects of this in children and adolescents. So sorry. Every time you're on the thing, you're going to have something to come live. Give me just 2 seconds.
And Oxford outside the PDER. Security alert. Outside the building. 21st and Oxford outside the ER. Security alert.
Wow. So sorry.
21st and Oxford outside of the ER.
Okay, great. I'm so sorry. Welcome to the hospital. These are things that happen to us during the day. So really what I was going to say is the second goal is that we just want to continue to put some emphasis on the fact our city health department has really done a great job of giving us good information, having good press conferences talking about the situations, and we just want to serve as a reminder for the fact that we want to encourage the things that they are seeing and just continue to mask when appropriate, which is like all the time unless you're by yourself, alone. Mask, social distance. Please avoid settings that have large numbers. I have an 11-year-old who attends school, and I asked him last night how he felt like compliance was with some of the mandates that had been asked of them, and he readily talked about how it has waned some since the beginning of when school started for himself. I mean, who he was talking about was himself. And so just a reminder to really encourage your children and things. We want to stand behind what it is that the health department is saying on this. So it's my pleasure to introduce Dr. Laura Johnson, who is with us today. She is, first of all, our Chief of Staff here at the Covenant Children's Hospital, and then she is also Chief of the Division of Inpatient Medicine at Texas Tech University Health Sciences Center. I have asked her today, she's a practicing pediatric hospitalist and is a subject matter expert on MISC, as it were, because there's little known about this, and we just want to talk about that. So, Dr. Johnson, thank you so much for being with us today. I'm going to turn this over to you for some information.
Thank you so much. So, as Dr. Thompson mentioned, MISC is the main topic that I want to share some information with you about. This condition is rare, and I think that's one thing that's important to know. Nationally, there have been over 1,000 cases, about 1,100 or so, although those numbers are, of course, continuing to increase. This condition can be very serious, and in some early studies, many of the children who are diagnosed with MISC may require treatment in the intensive care unit, and it's recommended if you have a patient who needs to be in the hospital with MISC that they be cared for in a place that does have a pediatric intensive care unit to make sure that those additional resources are available if needed. What we see in terms of when children present is they have fever. They often have symptoms that can be really variable. So this is the hard part in trying to give you guidance about exactly what kind of symptoms we're looking for. But generally those symptoms are involving multiple different organ systems, at least two. And what that can mean is that can be involvement with heart is pretty common. Over half of patients will have some degree of heart involvement, heart failure, impairment of heart function. It can also involve the lungs, the kidneys, the gastrointestinal system having symptoms like vomiting, diarrhea. Can involve the skin, can involve the nervous system causing confusion, and can also involve the kidneys. I'm not sure if I mentioned that. So we're talking about all kinds of systems that can be involved. There are some lab tests that we obtain to help us make the diagnosis. Those are multiple different tests that give us information about the overall inflammation in the body. One of the challenges when we think about MISC is the CDC has a case definition, and that's what you see when we don't know a lot about a condition. We're trying to figure out how we're going to make the diagnosis and when to call it MISC versus not. And there are a number of other conditions that we see in children much more commonly than we see MISC that could actually be the cause of all those things that I've mentioned. So it's important that if you're worried, if you have a child perhaps who has fever and has some other symptoms, talking to your pediatrician or your primary care provider is always a good step in terms of getting guidance about what to do with that. So, the other piece of this that I didn't mention in terms of when we consider MISC is virtually all children who, for whom we've made this diagnosis, have either a current or more often a recent COVID infection or exposure. So this doesn't tend to be something that we tend to see right when children may have a positive test for COVID or some mild COVID symptoms. Most commonly it happens 2 to 4 weeks later. So this is really more of a post-COVID kind of syndrome that we're seeing. I'm going to stop there because I've shared a lot of information and I know you may have some questions, but I do just want to emphasize again, I know as a parent when you're hearing about something that certainly scary and certainly something that we, as parents, we all worry about keeping our kids safe. It's important to recognize that MISC is rare, that most kids with MISC do have a good outcome, but that COVID is something that we still want to avoid. So the best way to prevent any concerns about MISC is to not be exposed to or have COVID in the first place. And that brings us back around to all the things we know about following our public health guidance, which I'll be honest with you is hard to do 9 months on, right? So one of the challenges that we're having is I think everyone's tired of COVID. And I'm also tired of COVID. I think all of our caregivers, our medical staff are tired of COVID, but it's not going away anytime soon. And so when you think about what can I do to help keep myself and keep my family and keep my kids safe, the most important thing is we've got to keep doing all the hard stuff, which is not getting together socially, doing things remotely and at a great distance, and wearing your mask and all of those things that we know are helpful. So, thanks so much.
Do you have a closing statement, Dr. Thompson, or do you like a question?
Yeah, I'm happy to just kind of have a closing statement and then we'll take some questions. I just want to reiterate that our goals in this are to bring education. Dr. Johnson touched on this. Certainly, we don't want to incite panic or anything because of something that's very remote. And I think the 2 statements that bear repeating are this is a very rare condition, and even in children who get this, mortality is rare. So those things are true. Part of the reason we felt like we needed to bring this information is because the fact is when we start seeing this in our city, we just want to bring education to this. And then lastly, I would just underscore what Dr. Johnson said, which is our duty is to continue to do the things that we know from the health department and other medical authorities about what we can do to curb the spread of COVID-19. And the last thing that I would say, this isn't children's, we're having this about children, but I would just use this as a shameless plug to say, y'all, our adult hospitals they're full, their workers are tired, we are running out of room, and once again, I would just use this as an opportunity just to ask for compliance with the things that we know to do from a public health standpoint. So thank you all so much for joining us today, and we would love to answer some questions.
I can start. I'm Sarah Walbridge with the Lubbock NPR station. I'm heartbroken to hear about this death. What else can you tell us about that kid, age range, and where they were from? Would be helpful.
So as you know, I'm always bound by HIPAA and things that I can say. What I can say is it was a child who was less than 10, and it was a regional child who came to us for care. What I will tell you is consistent with other things that we have seen in MISC. And again, I'm going to point out that is not very much. As Dr. Johnson said, this is just a very not well understood complication of COVID, but it does happen quickly, and so things change very, very rapidly, and that's part of the reason we want people to be aware of those signs and symptoms to that.
I'm Dave Montes with the Lubbock. So I was just wondering, if the MISC is anywhere related to a cytokine storm that was early on kind of we talked about when the pandemic started?
Sure. I'm going to defer that to you.
Yeah. So, we talk a lot, I think, in adult care about the cytokine storm. I think the biggest difference is certainly that kind of inflammatory cascade that we can see. It has some similarity. The biggest difference when we're talking about MISC is, one, children's physiology is different than adults, so we're going to see some differences there. But two, it's really much more a post-viral issue. Whereas in adults, and I'm not an adult doctor, but from my reading, my understanding is that often that cytokine cascade happens in the acute phase of the illness, not necessarily a presentation, but within the first week or two. Most commonly with MISC, again, it's 2 to 4 weeks after either the illness or potentially just an exposure. The other thing that I should mention, kind of following along with that a little bit, is sometimes we will see children who present with MISC who may not have had a positive COVID test a couple of weeks prior, and who may not be positive when we test them, but they may show signs of having had a previous infection. So that's another common thing that it may, again, it's not right when the infection happens, it's later. And certainly we're trying to understand more and more about this syndrome. Specialists across the country are working on it, but there are a lot of things we don't yet know about why that happens, why it happens in some children, and certainly not most children. So those are ongoing questions.
So is it safe to say that the MISC happens after the infection is cleared, or is it still?
That is generally speaking true, yes. It's not 100% true because it's very hard to have any certainty around all of these things, but most commonly, yes, it's after.
Oh, it's Taylor Katie. So are you all concerned going into winter time now that we're seeing an additional surge in cases?
So I guess I'll speak first. I think the trends that we're seeing nationally, but perhaps most importantly locally, are not going in the right direction. Whether we're talking about children or whether we're talking about the population as a whole, things are not going the way we want them to go. And I guess there's maybe a little bit of flattening, but we definitely haven't seen things start to improve. And I think it's too early to say that we're past our peak in this fall peak that we're experiencing. I think there's lots of reasons to worry that we're far from our peak in these cases. And again, kind of bringing us back to MISC, that's when you tend to see these cases starting is when you've had a lot of community spread within your region. So in the New York area, they saw a number of cases, and they really began many weeks into their explosion of cases. And it's a little early to say for us here, but I'm worried that that's kind of fitting with that same pattern, that when your community spread starts to really increase, then you start to see more cases. But I think we've heard national experts and local experts warn a lot about the challenges of fall and winter, both because social distancing and things like that are a little bit harder as we're driven indoors because it's cooler and things like that, but also because of all the other viruses and other conditions that we see every winter. So Dr. Thompson may speak more to this, but our hospital is generally full of kids who are sick with RSV and flu and other respiratory viruses every winter. And we often are really working hard to try to make sure we have the capacity to care for those kids. And now we have this overlay of COVID on top of that. And so, yes, I think it's fair to say that winter is concerning. And I don't want to be alarmist, but I also think sometimes when things have been going on for a while, we get used to it. I was reflecting on the number of cases we're seeing each day that are all in the 3 digits and many over 500 in terms of the daily counts. And if you remember back in April, if we saw cases above 30, everyone was appropriately concerned, but we've become really numb to those numbers. But each one of those cases is a sick person. And now, luckily some people may have mild symptoms, but they may well infect someone else who won't have mild symptoms. And we know our hospitals are full to the brim, especially with adult patients. So, yes, scary.
The only thing I would add, I agree with all of those things. Winter's always full for children's hospitals, and so certainly everything that Dr. Johnson said, I would echo. The only thing I would underscore is, as a hospital administrator, when I think about capacity, it's not just a place to place a patient. I can find a place to put a bed and hook some oxygen up and some things like this. Really, the thing that happens is you have to have a place to put a patient, and you have to have caregivers that take care of that patient. And so it is also true that the more spread that we have within the community, the higher number of our caregivers and employees that are out because of COVID, either positive or because of COVID exposure. And so one of my very big concerns right now is being able to maintain enough people that have the skills to take care of the patients that we place in the beds. And so that's the only thing that I would add just from a hospital capacity thing. And the reason I say that is because those same caregivers, you know what they get during flu season? Flu. And those different kind of things. And so I will also shamelessly plug, please get your flu shot this year. We're saying this may be the most important year for you to get your flu shot. I would say every year is the most important year for you to get your flu shot, but that's the only thing I would add to that.
And while students are in school, is that also a concern for you all as well?
I'll answer, and then I'll let Dr. Johnson, tag on this. Certainly, there have been studies that have actually shown that there hasn't been a ton of transmission in schools. And so I think that there is some data to suggest some of those things. I probably sometimes worry more about what I'd call drift in the schools, which is what Dr. Johnson, alluded to. Well, we are a long way into this, and I think people are sick of it. I get sick of wearing a mask. I mean, I'm saying I have to personally remind myself, okay, this is what I have to do, and even though I'm not feeling sick. And I think when you put that on kids, can you imagine? I mean, can you imagine making that kind of a, responsible decision when you're 10? These can be some hard things. But the second thing that I would say is, in some ways, I actually worry more about what's happening when they're not in school. And so I think the schools, I've been actually very impressed in Lubbock with what schools have done in response to this. But what we certainly know, there was an article that came out that I read this morning that was talking about the places where this is spreading, and schools are not listed on that. I think when we follow those guidelines, it is safe, to go to school. But man, we got to do the stuff that we know. Like, if your kid is sick, they cannot go to school. And that should be true all the time. But we have to be meticulous about the things that we know to do with social distancing and masking and ventilation and outdoor activities when you can. And then we've got to be consistent to not then go to events and other things outside of those times where we congregate in these big areas without protection. So I'll see if you have anything else to add.
I agree completely.
Jake Archer, Fox 34 News. When you see this syndrome happen in kids, what are the types of treatment that happen to try to combat this issue?
Yeah, do you want me to address that? So certainly, I mentioned before that children who require hospitalization with the syndrome should be cared for in a hospital with the pediatric intensive care unit. The treatment initially tends to involve various medicines to try to address the inflammation that we see. And so that often is a medicine called IVIG, or intravenous immune globulin. It may include steroids, and there are some other even more specialized medicines that we may use as well. And then what I would say the mainstay beyond those medicines are various kinds of supportive care that are there to help address the organ systems that may be impacted and not functioning appropriately. So a lot of that may be regarding the cardiac system. We know the heart is often involved, and so medicines to help the heart work better. We also worry about clots and other sorts of complications, so there may be medicines aimed at that. There's no one-size-fits-all treatment approach because it depends on the presentation, the kinds of symptoms that the patient has, and then it depends on which organs are involved and how things progress.
And just follow, in the cases that we've seen here, were these children already hospitalized, returned home, and then came back with the MISC inflammations, or were they kind of quarantined and then presented to those symptoms?
I can answer that question. That both patients that we had hospitalized had not previously been hospitalized prior to this event.
And then I have a question. What are the age ranges for parents, and what are some symptoms that we could look for, and what do we need to do if our child has those symptoms?
Yeah, so the case definition is from age 1 up to 21, but in general, it's going to be between 1 and 15 are the most common ages that we see. Again, it's fever for at least a day without another explanation. Now, there are lots of reasons why kids get fevers, as we know, and most of those are not going to be this, which is why reaching out to your pediatrician, to your primary care provider, if your child does have fever and other symptoms going on, is the important step to take. Definitely trouble, anything that's concerning in terms of trouble breathing, turning blue, being confused, where they, where that's a change from their normal mental status, any of those things, you should come to the emergency department. But if there's ongoing fever and maybe some more mild symptoms that could involve vomiting or diarrhea or skin rashes or swollen extremities or maybe red eyes or lips or all of those kinds of things, calling your primary care doctor is always the best first step with that.
I know that you all said that usually in the COVID unit you all are seeing less than 10 patients at a time. What are some of the symptoms that they're exhibiting in that unit?
The patients that we see acutely, because I think this is important to kind of keep in mind that the MISC, again, generally is several weeks down the line, and generally acute COVID, what we've seen in children has mostly been one of two scenarios. One, where they're having a respiratory illness, like a viral pneumonia kind of picture. Some of those have been severe. Often they're fairly mild, but more of a mostly respiratory situation. COVID, even acutely, can involve multiple organ systems, so sometimes we've seen some of that. But then the other thing that we see is we see children who have diseases that are unrelated, perhaps diabetes or some other concern, that they happen to also be COVID positive. So some of our patients do fall into that category as well, as we're careful looking for any possible COVID-19 illnesses to make sure that we're caring for those patients appropriately and keeping everyone safe. And then Dr. Thompson mentioned we've had a lot of, because we are screening all of our delivering mothers to look for COVID. We certainly find it more often than I wish we did. So we do see that. Most of those women do not have symptoms or any significant symptoms. But we have had a few pregnant women who have had kind of respiratory symptoms as well.
I think my number is less than 5 of the pregnant women that we have found who have actually had to be on some type of support other than we just happen to find it at their delivery.
And what are the age ranges for the patients who are in the acute unit?
I'm not sure the youngest patient. We've had patients from weeks old to 17 from a pediatric side, and then of course the women are, the ages that women are when they have babies. So we've seen the whole spectrum.
And keep in mind also, we're going to have those women's babies in that unit, and so those babies, by and large, do not show positivity or any symptoms. So, it's not really fair to say we have 1-day-olds in there, if that makes sense, because really they are just in there because they are there with their mother, if that makes sense. So I think the youngest that we have had in terms of they have come back with, either symptoms or COVID positive have been a few weeks. So don't let the 1 day hold. It's confusing.
And can you give us a percentage or a rate of the chances of a child catching MSIC and ending up in the hospital?
I'm not sure if I can give you a good percentage. There are, like I said, there are about 1,160 cases that have been reported nationally in total. And there are certainly vastly more cases of COVID in that age group that are reported nationally. And we know that we're probably under-diagnosing, because a lot of children are going to have mild to no symptoms. Of that 1,160 or so, there have been 20 pediatric deaths from MISC. So those numbers are available from the CDC. I also, just looking at the latest numbers, just in terms of COVID overall, there have been about 140 pediatric deaths from COVID. So most pediatric deaths from COVID are actually not MISC. But putting all of that together, happily, luckily, thankfully, most children are going to have a good outcome. But one child is too many.
Just as kind of like a follow-up with how these children get it, it's post-COVID, but is that like they just had COVID or they're re-exposed to COVID, or if you could just clarify that a little bit.
Yeah. So, with the caveat that we're still learning a lot about this disease, but by and large, we think it's an immune response to having had COVID. And there are a whole list of pediatric diseases that are like that. This isn't the first situation where you may have some kind of syndrome, some kind of illness that happens as a result of having had a virus a few weeks beforehand. And that's what we think, by and large, the patients that we're seeing with MISC, that's what's going on. They've had exposure for a positive test that, again, was a couple weeks ago, and then they developed this inflammatory condition.
All right, let's do one more question and we'll wrap up. Okay, guys?
Yes, is it possible to be asymptomatic and still get MISC?
Yes, it absolutely is. So, sorry, I'll just keep my mask off. It's not unusual at all to have not necessarily had a positive test, but to have that antibody test that shows that you've had an infection in the past. But 98% or so of patients who have been given a diagnosis of MISC had evidence of having had COVID one way or another, whether they had a positive test or whether the antibody test was positive, or some way to determine if that's true. There's only about 2% for whom that may not have been clear, but they're in an area where there's a lot of circulating disease.
Yeah, I would clarify that there's a way that we can acutely test for COVID, and then there's a way that we can test antibodies to see if you have had the disease. And so when we have children that present with signs and symptoms that are concerning for this, there's a way that you can look for a past exposure to disease without having an acutely positive test in the moment. I think that was our questions. I really want to thank you guys for joining us today. And again, I would just close with, if you have a sick child, we are blessed and loving to have wonderful medical providers. Please call your medical provider if you have questions, and make sure that we do all of the things that the health department is asking us to do. Thank you guys for joining us today.
Thank you very much.